determinants. And Dr. Ann Good, starting alphabetically, what are social determinants of health?
Yeah, thanks. And it's a privilege to be here today. And I'm really looking forward to this conversation. You know, historically, healthcare has been focused in on disease management. And that's how physicians are trained. That's how nurses are brought in, pharmacy, et cetera, et cetera. Over the past number of years, we've appreciated that not everybody does well. In fact, some people do worse with certain diseases. And so we began to think through more in terms of how do we generate better health and wellness for everyone. And that's kind of come under the term or the rubric, if you will, of what's now termed population health. How do we help the population as a whole begin to look at their lives differently? And how do you then live your life in a different way so that hopefully you're able to maintain better wellness, have less disease, less illness throughout your entire life? As we've become more and more appreciative of all of these, this terminology around social determinants of health really has come into play. And Lisa Fitzpatrick is far more savvy on this than I am, so I'm looking forward to her answer. But at its core, it's those basic components that create the social environments in which we live, and how do we thrive or how do we not thrive. So how do we obtain our food? Do we have healthy food? Where do we live? Are we in safe environments? What's our community like? Do we have support structures? Are we in an area where there's a lot of violence, or are we in a safe, protected area? Are we in a rural area? Do we take different kinds of medications that may or may not help us? So there's this whole constellation of things which begin to put together the puzzle pieces of the social aspects that determine how our health or our well-being are ultimately evolving. When you have poor social aspects, you tend to do less well, and you are therefore subject to your illnesses and your diseases much more readily than other folks who are living a more healthy lifestyle, who may or may not have better social determinants, if you will. So that's kind of it in its essence, if you will.
Thank you. Dr. Fitzpatrick, what would you add to that?
I thank you, first of all, for having me here, Christian. I'm always happy to talk about nature, as it's something that's very important to me. I wouldn't add much to what Dr. Ann Good said. I think that was a very thorough definition. Unfortunately, the way we're thinking about social determinants now has become fairly narrow as we think about how to pay for the services to support social determinants. We mostly are talking about transportation support, food, and housing. The challenge with those is that it's hard to develop policy interventions or to develop regulations around payment and around support that will provide the kinds of supports people across the spectrum need. So to give you an example, one of the big interventions for social determinant that's considered a social determinant of health intervention is providing transportation to the healthcare provider or to a doctor's visit. And we've known for years that transportation is a barrier to accessing healthcare. But the issue is that's not true for everybody. Maybe a portion of patients can't get to the doctor, but the truth is when people are motivated and really see the necessity of engaging in healthcare, they find ways to get there. And I always think about a patient of mine who had to take 3 buses to come and see me when I moved my office from one part of town to the next. So I think that while we talk about these environmental factors that Dr. Ann Good talked about as social determinants of health, we really need to broaden it and be very intentional about addressing social determinants in a much more visionary way, so that it does include things like how do we provide safe environments for people. I've moved into a neighborhood that struggles with social determinants, and I noticed trauma chronic trauma, not just trauma from gun violence or trauma from robberies, but just the trauma associated with being poor or living in an environment where there's scarcity all around you. And these are the kinds of things we have to address if we want to talk about addressing social determinants in a holistic way. And then finally, I'd be remiss as a person who's passionate about health literacy, not to address the need for interventions to help people improve their understanding of their own health. What does it mean to be in good health? How do you interact with the healthcare system? Do you understand what doctors and nurses are saying to you? All of those things should also fall under the umbrella of social determinants of health. And so I'm hoping over time we will transition from this very narrowly focused discussion about social determinants that primarily focuses on the three things that I talked about: transportation, food, and housing, and broadens it so that we can help people live healthy lives in a way that's realistic for them.
Thank you. You know, one of the interesting things about the conversations that we've been having in the lead up to today is this idea of nice to have versus need to have. And I really just want to get your perspective on whether or not nature is actually a social determinant of health. If so, in what ways? And is it a need to have, or does it fall a little bit higher on the hierarchy of needs? Is it a nice to have?
So I'll go first on that. I think, and again, you know, there's a saying, where you stand is where you sit. And because I've worked my entire career with underserved populations, Black and Brown communities, most recently Medicaid populations, my perspectives about how we should address some of these health challenges and health policy related challenges are informed by what I'm hearing from the ground, from my neighborhood, from my patients, from the work I've done in these communities. And so for me, I think it should be both, but in the population I serve, it's a nice to have. And it's a nice to have because after many efforts trying to get people to be outside, even in groups, starting a wellness nonprofit to encourage underserved communities to engage in exercise and activity, it's very difficult when you don't have the infrastructure or the support to address the bottom of the pyramid issues, specifically around safety. So if you go through my neighborhood, you'll see people outside, but they're not necessarily outside because they think it's good for their health. They're outside because either maybe they don't have a peaceful place to live, maybe they're homeless, maybe they're outside so that they can connect with other people. And you'll see a lot of people on what we call the stoop. They're sitting on the porch, but not necessarily because they're doing it because it's good for their health. So I think we need to make a connection for people, or at least the people I serve, to help them understand it is important to be outside. And here's why. This is what it'll do for your well-being. This is what it'll do for your mental health, and so on. We really need to make those connections. So to answer your question, it's a nice to have, but when I'm in my condo up in downtown DC, I would say it's definitely seen as a necessity.
Mm. And I think yes, Dr. Younggood.
Yeah, no, I was just going to build off of those comments. And, you know, if you think about human beings and their basic physiologic function, biological functions, et cetera, then being outside, being exposed to nature is a must-have. We need it. And, you know, we're finally getting to a stage in our sciences where there's more and more evidence that is coming forth that there's a whole variety of neurochemical shifts that occur when you spend time outside. And there's really, you know, that whole sense of well-being that increases, but there's also general longer-term physiologic benefits that then actually impact our wellness and impact our disease prevention. Our immune status goes up, et cetera, et cetera. There's a lot more that needs to be brought forward in the scientific research and the literature, but on a basic human level, yes, it's a must-have. But I would totally agree, depending on your socioeconomic status, depending on where you live, depending on all those other social determinants, it's kind of a nice to have. People do go outside for that sense of community. They do go outside to be out of their home environments, if you will. They don't necessarily appreciate that they're getting some benefits by doing so, but certainly they are indirectly benefiting. Now, whether they then make a conscious social decision to pursue the outdoors, then that's a different set of parameters entirely. And so I think part of what we need to do is build that awareness, regardless of your social status, on the importance of that. And we have to build that awareness inside of the healthcare community as well. Physicians, nurses, other providers, the institutions or the organizations where they work, we need to work at helping to integrate this effort to increase the awareness on the importance of being out of doors. Many of the better performing healthcare delivery systems in the country are now, setting up a whole variety of peripheral satellite clinics, satellite care arenas, if you will. And as a part of that, yes, they're helping with trying to better manage the social determinants. They're trying to help people improve their wellness, but it's still very basic, as Dr. Fitzpatrick was saying a few moments ago. So we have to increase that awareness inside the delivery system and into the healthcare providers, that no matter how you can catch it, if you can catch some of that outdoors and some of that nature, it will continue to help you in terms of your overall health and well-being, because we as humans, we need it. It's a part of what we need.
I'm really glad you brought that up. If I could just respond about the healthcare workers, because healthcare workers are human just like anyone else. And I'll just use myself as an example. Over the last 10 years, I've been in very stressful environments. And while I know about the importance of being outside and how much that improves my mental and physical well-being, somehow I have neglected being outside. And I think for a lot of healthcare workers, we struggle with a lot of the same health challenges as the rest of society. And so I would love to see some efforts, including the efforts you're making, Dr. Angood, to help improve the awareness and motivation of healthcare workers, because we cannot encourage our patients and our clients, members of our communities, to be healthy if we're not also embracing it and leading by example. So I really appreciate you focusing on the healthcare workforce, because we need that support as well.
Before you jump in, Christian, I see we have, a good audience to hear. Likely some are in the healthcare workforce. But just to drive the point home, if you're a consumer of healthcare, actually, I think you need to be aware that within healthcare, as in other industries, but within healthcare, it's being very much recognized and brought to the forefront that the healthcare workforce is under stress and duress. There's strong degrees of anxiety, depression, burnout, and suicidality in the healthcare workforce. And it's something that many of us in our different platforms are trying to help address. But the practices that you go into as a consumer of healthcare, or the hospitals and healthcare delivery systems that you go into, one of the things that you have to be aware of in the back of your mind is that the healthcare workforce, for a whole variety of reasons, may not be as healthy themselves as we would prefer. Some of the statistics, just to drive the point, are that upwards of 50%, half of the workforce, physicians, nurses, pharmacists, etc., are feeling fairly large degrees of the symptoms related to burnout. And the The suicidality rate, just to drive it one more point for physicians, is around twice the normal population these days. So we have a lot to do within the healthcare workforce itself to help them to embrace the importance of better health, better wellness, and how do they incorporate not only for their patients and their institutions the importance of nature, but how do they do it for themselves?
So what would you recommend here? I mean, if we're trying to get the healthcare provider community to begin to embrace the health benefits of time outside internally so that they can then prescribe it better to their patients, what strategies have you seen that have proven to be effective in raising that baseline awareness within the healthcare medical community?
Well, all of these things have to be multifaceted. Like Dr. Fitzpatrick, prior to my current work, I spent many, many years in the clinical environments working in public safety net hospitals and doing the world of trauma surgery, which involved a lot of violence prevention activities. And what that helped me appreciate was there are actually many agencies out there working inside of our communities, but they're not necessarily integrated or linked together. They don't necessarily have the same focus on what is needing to be done. And so it's the same inside of our healthcare delivery system. We need to, on a multifaceted approach, as we address the healthcare workforce wellness issues, and we try to help everybody move through their clinical delivery environments in a better, healthier, more holistic way. We have to then help improve the systems that they're working in so they don't get worn out and stressed as individuals, and take advantage of that awareness for them on a personal level to translate it over to the patients they're caring for. And then help those patients get plugged into the support environments that Dr. Fitzpatrick's so expert at to help them augment further those approaches to how to integrate nature and improve all of the other social determinants. Healthcare is probably the most complex industry out there, and therefore it's going to take a complex series of multifaceted approaches for us to get there. And increasing awareness is the first step at all levels.
Thank you. And we're starting to get some good questions coming in, and we want to get to those as soon as we can here. So please do take advantage of the Q&A section and go ahead and ask any questions that you would like us to address to the guests today. And Dr. Fitzpatrick, you know, with your organization and its focus on improving health outcomes for Medicaid beneficiaries and their communities, in part through health literacy and patient engagement, I'm just curious, how much nature do your patients have within walking distance and that safe access?
Well, I think related to my initial comments, when you asked about the necessity versus nice to have, the vast majority of people I work with take the bus or they walk to get to where they have to go. But I would say using public transportation is the most common form of getting from point A to point B. And so inherent in that is being in nature. But again, as Dr. Anga pointed out, people aren't necessarily thinking of this as a health benefit or an activity that benefits their health and well-being. And some even think of it as a burden to have to resort to public transportation. We try to start a walking group throughout the community. And the feedback we got from a lot of people was largely related to the safety issues. I had one person tell me, this was a woman in her 50s, who said once she goes home from work, she doesn't come out of the house because she doesn't feel safe. And this was a woman who smoked, and I developed a relationship with her because I wanted to try and be a resource for her because she has a lot of other health issues, and I think being outside would be hugely beneficial for her. And to this day, that was over 2 years ago, to this day, I have not been successful in getting her to feel comfortable coming outside to walk. So I think that, our biggest challenge is, even though people can be outside, they can be standing on the corner. It's also important to get people to move and to understand the value of exercise, but we have a responsibility to try and find ways to make the environment safe enough so that people feel they can be outside and enjoy the benefits of being outside without feeling like they're putting themselves or their children in harm's way.
Mm-hmm.
So I would say that's one of my biggest frustrations and one of the biggest lessons I've learned after moving into the neighborhood I live now is how the safety issue is looming large in so many people's lives. It's something that I knew about intuitively, but I took it for granted until I moved here. And I even think twice sometimes about how I move in my neighborhood. In my former neighborhood, where I felt very safe and never thought about these issues, I rode my bike to work. I I was always outside doing something. And in this neighborhood, I actually think twice. And I also um, I conduct an analysis before I leave home about what's on my person, what I need to do. I don't wear my headphones in this neighborhood. So I think these are the things we take for granted when we live in places where we don't have to think about these safety issues. But the safety issues, I would say, are the biggest barrier to having people engage in nature and being outside.
Mm-hmm. And to that point, I think there's a good conversation that's come in from Matt Freer with the Chicago Park District about the conversation metrics around defining what nature looks like in the most basic context. How do you message that to your patients, Dr. Fitzpatrick?
Well, we really want to encourage people to be outside, even if it's to come out on the porch, especially now. So we've talked a lot about just being outside, and when you're outside, take 3 deep breaths just to get some air in. But it's not a uniform conversation because some people really don't value being outside. They don't like being outside, and some of that is because of the circumstances they dealt with throughout their lives. So someone who's been homeless and had to sleep outside may not be interested in being outside or see the value in that. So I think it's not just one message, and we have to communicate about what it means to be in nature or be outside. And it's, a conversation that we have to tailor based on who we're talking to. But at the very least, if I could just get people to go outside every day and take a few deep breaths, I would be happy with that.
That's great. Dr. Ann Good, you're also the chair of IRI Wild, which is an institute for thought leaders who are working to restore a viable world for humanity and all life on Earth. And I'm just curious how your work with the American Association for Physician Leadership and your work with IRI Wild intersect.
Yeah, no, thank you for that question, Christian. And IRI Wild is a nonprofit that's fairly young, but it's designed to be a online think tank that is very much oriented to helping us as humans restore a viable world for not just humans, but for all life. It gets back a little bit to some of my earlier comments. As human beings, we need to connect with nature. We need to be able to be at, in synchrony, if you will. So we have to increase our awareness and increase our level of consciousness of just how far we have drifted from that need for being connected close to nature. So we're really trying to cultivate sort of a world of eco-citizens, to catch that phrase, so that we really foster a thriving and flourishing planet overall. And that's an integration of our psyche, our psychology, how we interact inside of society, and then how do we view that natural world differently. So yeah, given how this whole conversation has gone so far, people in the lower socioeconomic groups are not thinking in this way in the least. This is a higher level in the pyramid type of thinking, but that also underscores the importance that all levels of our society need to be thinking about nature, how we as humans interact with nature, and then how do we help others interact better with nature as well. And so some of what we're trying to do within the American Association for Physician Leadership is with the philosophy that at some level, all physicians are leaders because society looks at the medical profession as a lead profession. How do we encourage physicians to work with other healthcare providers, to work with patients so that we can then help change our delivery systems and improve the ways in which people look at nature and the benefits that nature can provide for themselves, their families, and how do they get better wellness approaches overall. It's complicated, and a lot of what I've just described in the last few moments are higher levels of thinking, not much specifics in there, but within the Ivory Wild sets of initiatives, we're driving to the specificity. Within the Physician Leadership Association, we're driving to that specificity. But as I said earlier, it has to be a multifaceted, integrated type of an approach by collaborating strongly across a whole variety of associations, nonprofits, governmental agencies, for-profit sector, groups like the Park Association, groups like All Trails, and really build this awareness, build this common set of understanding on the complexity, whether you're in the lower socioeconomic groups or whether you're in the high end of the socioeconomic groups. You still need that awareness. You still need to integrate. You know, it's a well worn comparison, but everybody who smokes cigarettes and tobacco these days, they already know that's not good for them. So how do we, from a public health perspective, get the messages through? And it takes time. The anti-smoking campaign is decades old, but it made progress over time. So what we're trying to do here with nature and the importance of nature, it's going to be a long haul process, but it's got to be multifaceted, collaborative in nature, and as best as we can, integrate it into the healthcare delivery system so that we can get it out into the public.
Mm-hmm. Thank you. And we've got some really good questions coming in. I see that some are coming in through the chat feature. So if you could make sure you put them in the Q&A section, or I have to toggle to my phone where I am sending you these questions. But before we do, I just want to recognize the fact that every single thing that we're doing in life these days is within the greater context of the pandemic. And Dr. Fitzpatrick, you've had some really interesting pieces in Forbes lately about the coronavirus and persistent health disparities in Black America. And I just want to ask, what has the pandemic revealed about society today, particularly as it relates to Black and Brown communities?
Yeah, it's revealed the lack of support for these communities, but it's not new information. I think we've had instances in society when these disparities and the lack of access have been revealed to us. And the instance that comes to mind is Katrina. When Katrina happened, we had very similar conversations to those we're having right now related to COVID-19 and the death disparities particularly. And, you know, there are lots of debates going on about why is it that Black Americans and even Hispanic Americans have such much higher death rates. And some are saying, well, in the United States, we have background rates of obesity, high blood pressure, diabetes, obesity across races. And so that alone couldn't explain it. That might be true, but I also think what's contributing is stress. The stress and the impact on the immune system of stress when you live in a chronically stressful environment, such as racism in the United States, but also living in scarcity. I mentioned that before. So when you feel like you have to fight for everything, whether it's recognition, access to healthcare, access to the basic things you need, like good food, or even access to nature. I think these things all play into what we're seeing with COVID-19. And I think the death rates among Black and Brown Americans are higher because of the baseline levels of stress that are exacerbating the impact of these chronic diseases. But clearly there's some sort of study that needs to be done to look at the physiology of this, to really determine if that's what's happening. The final thing I'll say is Dr. Anthony Fauci commented on this at a press conference and said, "We've known about this for a long time. And after this is over, we'll have to revisit why we continue to see these consistent disparities." And he said, "There's nothing we can do now." And I think that's not true. I think what we can do now is pay attention to where we prioritize access to testing and access to healthcare services. Because a lot of these same places where we're seeing disparities in death rates and just COVID infection rates are also in places where people don't have the same access to healthcare. And you also see an increase in distrust of the healthcare system. So those are the things that are on my mind right now. How do we reach people, address COVID misinformation, and get people to trust the information so that they will present for care or even ask for the care that's available?
I could build on that a little bit, Christian. Certainly COVID-19 and all of its impacts, which we're still living through, have stressed our world on a global scale. There's no country in the world that's unaffected, and there's certainly no part of this country that's unaffected. As we continue to look at the infection rates and the death rates, we have to appreciate that there is an underestimation of those statistics because not everybody gets tested. And there's a lot of people who are sick at home. We don't even know they're there with COVID-19. There's a lot of people who have died at home. We don't even know that those were COVID-19 patients. As we then now begin to learn further and further the unemployment statistics and how those are going to continue on, the economic impact of this whole pandemic is going to continue to be felt. So it will be further unmasking the social inequities as other elements in our society get impacted as well. So yes, in the midst of every crisis, there is opportunity. And I think the opportunity as a healthcare system that we have is to, yes, look at social determinants of health again, but also appreciate as we live through this COVID-19 scenario, that all aspects of our society, all elements of that socioeconomic hierarchy are now affected. And so there are things that we can learn because the awareness is at an unprecedented level because of the combined effect of the illness, plus the economy, plus the fact that it's a pandemic and everybody's affected in it in some fashion. So it's a moment, unfortunately. I do have to, though, say the healthcare system is getting impacted significantly. And so it's going to be a little bit difficult to really mobilize the healthcare delivery system on these areas around nature and sort of want to have kinds of things, because in the physician practice world, the number of physician practices that have had to carve down their practice environments or are shutting their doors, looking at how to maintain or how to be acquired so that they can continue to live, the numbers are high. Numbers are high. The hospitals and the healthcare delivery systems, the financial impacts that they are feeling, huge, huge. So these delivery systems are under significant duress. That's just on the clinical delivery. Now even take it into the social services elements that help to support the healthcare delivery system in a variety of ways. A lot of them are poorly funded initiatives, whether they're government-based or through the nonprofit sector. They're all feeling that as well. So we're going to have to get creative and innovative as to how we message and take advantage of the opportunity that I was just describing. But we should take advantage of that opportunity to better message what we're talking about here today.
Mm-hmm. Great.
Can I just add one other observation that's related to this connection between what we're seeing now with COVID and people being outside, and that is people are less likely to be outside right now, which is why we're trying to encourage people, go outside, even if it's in your backyard or sit on the porch, so that you're not in the house so much, because so many people are afraid to be outside. Before this call, I had a webinar with a group of seniors, and most of them, and one of them actually has not been out of her house in 37 days, even to be on the porch or in her backyard. That's astonishing. And what is that doing to her health? And so I think we have to make a concerted effort to remind people, even though we're in a pandemic, you can still go outside. There are ways to be outside and still be safe and be healthy.
Thank you. And, you know, past pandemics, if you're looking at anything from bubonic plague all the way to the Spanish flu, they've resulted in some fundamental reorientations of society. I'm curious, you know, the flip side of every crisis is opportunity. So if you could envision a direct result of this pandemic that led to something that you felt very strongly about as it relates to nature and public health, what would it be, and how would we harness this crisis to get us there? One of you wants to answer that.
Wow, it's such a great and provocative question. I tend to be very cynical sometimes when it comes to change, not because I don't embrace change. I actually am someone who loves change. But again, you know, taking us back to Katrina, what changed post Katrina? I think in the immediate aftermath of Katrina, there was a lot of awareness, some solidarity. If you've been reading my Forbes blog, you also saw the one that's entitled, "We Are Not All in This Together," right? So I think the challenge is going to be to take the momentum and the interest and awareness in what's happening with these disparities and the need to provide support for underserved communities, and move that forward in a sustainable way, so that even a year from now or 5 years from now, we're not still having this conversation. And that's what I'm cynical about, because when things like this happen, we have a flurry of activity around talking about what a shame these disparities are, and then we convene about it, we write reports about it, and then the reports go on the shelf. And because the solutions are so big, like, how do you eliminate trauma? How do you eliminate gun violence in the inner city? How do you make parks safe? So I think because we get bogged down in the enormity of the challenge, we actually don't move forward, and we're a bit paralyzed by that. So I would love for the opportunity here to be to develop a plan and then inch it forward, not feeling like we have to address all of the problems at once, because that just will not be possible.
Yeah, it's complicated. It's really complicated. And on the one side, I'm an optimist by nature, and I always hope that things were going to get better. But I've been in healthcare long enough that, like you, Dr. Fitzpatrick, a little bit of skepticism. Mine comes from recognizing that there gets to be topics of popularity for a short period of time until another topic of popularity comes along. Population health has been a topic of popularity for in and around 5 years. How do we drive better value into healthcare has been a popular topic for in and around 4 or 5 years now. With COVID coming on, all of the focus is going to shift towards recovery, financial recovery of the delivery systems, alternative ways in which to deliver care, whether it's through telemedicine or different telehealth strategies. How do we improve the wellness of the workforce? How do we continue to look after all of those folks who are actually going to have some PTSD? You know, I was interested, oh gosh, 6 months or so ago, I went into New Orleans for some business trips, and spontaneously, every person I spoke to, somehow or other, Katrina came up in the conversation. How many years later? And we're still talking of Katrina. But the point was, every one of those individuals had been impacted by Katrina. They had adjusted their lives, but it was still a part of their lives. And so this current year of COVID-19 is now a part of all of our lives. And yes, they are going to create shifts in our businesses, in our economies, and in healthcare. It's certainly going to create changes in nature-oriented businesses and environments. So part of our efforts will need to be, again, how do we capitalize on this increased awareness? How do we drive the message without being opportunistic? But how do we also collaborate and share across all elements of the socioeconomic spectrum so that we can create the positive change at all levels, and certainly not forgetting about those in the lower socioeconomic groups. And this concept of population health, I think, has a moment in the sun right now, because as we emerge, we can think through what are all of the elements in population health so that we can stay healthier and more well in general. There will be another pandemic at some point, but this is ours right now, and we're going to have to live with the consequences of it for some time yet.
Thank you. And we want to get to some questions from participants here. But to your point, the opportunity just is before us. You can't go to sporting events. You can't go to bars. You can't go to restaurants. You can go outside. And so how do we capitalize on what people are experiencing while they're going outside and institutionalize that moving forward? I want to get to a question from Susan Allison Dean. She's a nurse. Thank you for joining us today, Susan. She asks, Dr. Fitzpatrick, is there evidence linking access to nature and improving resilience scores of those with high ACE scores?
Oh, so that's a measure of trauma, childhood trauma. And I don't know this literature well, but I know that people have looked at this. So I'd have to get back to you, or if she wants to connect with me afterwards. But I do know that there has been some work looking at the importance of physical activity on childhood outcomes. But you know, we know that kids who live with trauma, they grow up to be adults with lots of chronic health conditions. And so being outside, exercise, anything that can improve mental wellness will go a long way to mitigate some of those outcomes that we know they're destined for if we don't intervene early. And this is why I think it's so important for children to be able to play outside, which is something which has been eliminated in a lot of areas for our young people. So that's unfortunate. But I'm happy to, and I actually have colleagues at GW who specialize in ACEs. So I'm happy to follow up on that if necessary.
Thank you. We've got another one from David Berrigan with National Institute of Health. Time outside seems beneficial, but so is exercise. Research to date does not always seem to do that good a job separating these associations. How can we accelerate such research?
Yeah, well, he's from NIH, so we should be asking him.
That feels like a planted question. I don't know. No, I'm just teasing, but but he's very true. He's very true. You know, there is actually some literature, and we can get the references, but we need more literature. And that is that if you do spend time outside, your immune function does improve. Your natural killer cells in your immune system pop up. The sustainability of those measures are on the order of several weeks to a couple of months. And so the more time you spend outside, not necessarily doing much, the benefits to your immune system are certainly there. When you overlay exercise on top of being outside, then within reason, exercise, as we know, has several benefits on the immune function as well. But like anything in life, if you do too much exercise, then it can start to be of a negative effect on you. So you have to hit the proper balance. But there's no doubt, nature alone, beneficial to the immune system, and in several other ways. Exercise, no doubt, beneficial to longevity in the cardiovascular, cardiopulmonary systems and our immune systems. what's the right balance for each of us as an individual. We don't have that degree of specificity in our testing or our abilities to measure ourselves as yet, but we do have to continue sending out that message: get outside, get some exercise, and eat healthy and live well.
I have a follow-up on that though. So is there a compound effect of exercising outside versus exercising indoors alone?
We need our randomized clinical trials on that. David, we'll continue this conversation after the webinar. We've got one from Michael Carroll. I think if this is the Michael Carroll I know with the Wilderness Society. And he wants to know about the ways that we can engage the insurance industry in this conversation.
Well, if we can convince the insurance industry that nature and exercising outside is are social determinants of health, then we can engage them. I think the challenge will be where do we find the data to take to the health plans to substantiate that? So health plans are interested in interventions that will reduce unnecessary spend. And right now, the highest expenditures that are deemed unnecessary are avoidable hospitalizations, usually from someone delaying care or not knowing there was an issue and then finding out and having to be hospitalized, or people using the emergency room. So if there was some way to generate data to show that we could improve people's outcomes so that they were not being hospitalized unnecessarily or for avoidable reasons, or we were able to keep them out of the emergency department because they're healthy, that would be a way to start a conversation with the insurance industry. The insurance industry is struggling a little bit to figure out exactly how to pay for social determinants of health interventions. So this would just be layered on as another factor. If we were able to add nature as a social determinant of health, I think it would be a bit of a tall order to get them to pay for a program that focused on this, but you have to start somewhere. So if people have ideas about how you can generate data, making the direct connection between cost savings in healthcare and being outside or being in nature, I think you certainly could get the conversation started.
Yeah, the insurance industry is very, very complicated. The majority of the payers are in the for-profit sector, so their main focus is to make money and satisfy their stockholders. The model for insurance is based upon actuarial analysis, and the general concept behind insurance, as we know, is that those who are healthy subsidize those who are unhealthy. And unfortunately, a lot of the wellness models in different corporations haven't really panned out to show statistical benefits as yet. So we are with a fair amount of information on the negative aspects of healthcare and what drives higher costs. What we have is a relative paucity of the positive aspects of living a healthy and well life, and how do those bring insurance rates down. And there's very few insurance companies who are offering cheaper rates in their policy programs for those who are living healthy lives, because it's difficult to measure those healthy lives. Much easier to measure unhealthy lives than it is healthy lives.
Thank you. So what we try to do with this, the sorts of conversations that we're seeing in the Q&A is continue it on the Slack channel, that's Shift Nature Health. Dr. Terry Horton points out that we are working on a Delphi project to gather information to find out which data different stakeholders need. Researchers need guidance on what specific evidence different stakeholders need. So we are trying to work on that to the best of our limited ability. There's a lot of really good questions here about privilege and under-resourced communities. Matthew Millspa has one on, and perhaps this could be our last question. In translating, let's see if I can summarize this. communities of color can have a very low trust of the healthcare system and government systems supporting that work. Translating that to nature and health in an outdoor world largely represented by white men, how do we actively take the steps to develop trust and advance the nature health awareness and acceptance outside of communities of privilege?
Thank you for the question. I get this question a lot. I think you have to show up. And for some people, it may feel a little intimidating to show up in an environment that's so different than your own. But in that case, going through organizations. So no matter where you live, I'm sure there's an underserved population somewhere. And there's also a group of organizations that provide, whether it's social service support or some kind of support for that population. And so linking up with those organizations, becoming a volunteer, or just having a meeting to say, what is it you're doing, and asking how you can plug in. That is the best way to build trust. Showing up on the ground where people are so that they can look you in the eye and have a conversation with you is the best way to do that. I think it's one of the biggest barriers to implementing policies that work, because a lot of the policies are developed by people who are so divorced from the community they're developing policies for. And what they come up with often is not realistic because they haven't been in the community and haven't had a conversation with the people. Not just conversations with the organizations, but you have to go the next step and get on the ground and talk to the people that are being served, because it's quite an education. They will give you a lot of information, and they will respect that you took the time to come and talk to them directly and see what's going on and help in any way you can.
I could, though, just add on, because I know we're near the top of our hour, Christian, but diversity is far more diverse than just race. And, you know, I've got two young daughters who struggle with just being single white females in the out of doors. They feel threatened at times. I know within the LGBTQ communities, they have that same sense of anxiety at times. So I would encourage us, as we talk about nature overall, to think about diversity in all aspects of it. And how do we break down this perception that it's predominantly a white male thing? There's more white females getting out there, but we need the other ethnic groups to come in. We need others of all aspects of diversity to engage in nature, because the bottom end of it, we're all humans. We need nature. We got to get out there.
Well, Dr. Fitzpatrick, Dr. Angood, thank you very much for taking part in this conversation today. Very grateful for taking time out of your busy schedules. We're going to, let's see here, with that, bid you adieu. And if you'd like to say anything to the folks online, now's your chance.
I just wanted to say thank you for having me here, and encourage everyone. I don't think I need to encourage this group, but get outside.
Similarly, it's been a privilege to be with you, Dr. Fitzpatrick. I always learn something from you. And Christian, good work with this sets of initiatives. I look forward to seeing how it continues along for everybody. And to the audience, thank you so much for listening. It's been a privilege.
Thank you both so much. And thanks everybody for joining us here today. You can refer to these webinars. We are recording them and posting them on YouTube. We're also posting them for the research community on Figshare, and again on Slack at Shift Nature Health. We do have some upcoming ones. The next one, Tuesday, May 26th, is Nature, Health, and the Future of Environmental Leadership. So that's it'll be moderated not by me, fortunately, but by Florence Williams, the author of The Nature Fix. And it's with three of our emerging leaders: Juan Lazo Bautista, he was class of 2019, Ciara Green was 2016, and Jess Johnson was 2017. Ciara and Jess were both recipients of the Shift X Fellowship Fund. That's the $10,000 grant that we give to our emerging leaders for projects that are important for them in their communities. And then on June 9th, we have the Green Heart Project. This is the largest randomized clinical trial in the world of trees and its effect on populations. And this is with Aruni Bhatnagar. Dr. Bhatnagar is the director of the Envirom Institute at the University of Louisville. Chris Chandler, the director of urban conservation with TNC, and Dr. Joy Hart, who is one of their colleagues on the project. So we hope that you'll tune in for these and future webinars. And with that, thank you very much. Again, we have extended the deadlines for the SHIFT Awards, Emerging Leaders Program, and the research abstracts for the 2020 SHIFT Summit to June 15th. You can contact any of us with questions about those. So thank you very much. Stay safe, stay healthy. Thank you to all the folks that are putting themselves in harm's way to keep us safe. And do try to get outside. Thank you so much.